Well, concussions can be extremely dangerous, and getting the right treatment as soon as possible is critical to recovery, especially for kids and their developing brains. But children, they often have trouble articulating their symptoms. In today's Family First, we take a closer look at a new study that's discovering biological changes in kids who are likely to need more time for concussion recovery and how this can be used in the future to make sure kids are getting the treatment they need. The first thing Thomas Helsel remembers after a hard hit on the football field is being surrounded by his concerned coaches.
My head was throbbing, and we decided that it was good to go in to get checked out.
Doctors in the emergency department did some standard testing for a concussion, and one test that wasn't so standard.
I remember it because I thought it was odd they were asking me for a spit sample from a concussion. I was like, how does this relate?
The saliva sample was part of a study conducted by Nationwide Children's Hospital to discover differences in kids who recover normally from a concussion in a few weeks and those who experience persistent symptoms that last a month or more.
If we can detect children who might be at risk to experience a persistent post-concussive symptom, then doctor can treat them differently.
The study is a collaboration between Nationwide Children's Center for Injury Research and Policy, Division of Sports Medicine, and Institute for Genomic Medicine, whose scientists examined molecules called microRNA in the saliva of pediatric concussion patients at initial treatment, as well as 2 weeks and 4 weeks after their injury.
We can identify in a tube 800 different microRNAs, which one is which, and then the technology allows us to count what microRNA is there and how much of it is there.
Using this method, scientists identified 13 microRNA that are expressed differently in children who experience persistent post-concussion symptoms.
And that's important because if we can identify that at the time of injury, it can lead to earlier clinical intervention and really like a more personalized approach for caring for these children as they recover from concussion, especially if they're at risk for extended or prolonged recovery.
After some time off for a full recovery, Thomas is back on the field for his senior year.
I'm healthy, and I think I have, big plans ahead of me.
Now, scientists plan to expand on this research, and they hope that eventually saliva samples will be collected on the sidelines after a concussion to help doctors assess a child's risk and develop the most effective treatment plan possible.